is Leslie Ziegler, and I'm here at the Digital Health Summer Summit at UCSF, and I'm sitting here with Michele Ahlman. Hi, Michele.
Hi, how are you?
I'm doing great, doing great. You adrenaline from the stage coming down now?
Yeah, absolutely. I mean, I'm passionate about our message and being able to do it and share it here with all these people. A lot of really smart people. So in talking marketing, took it down a notch, which was great. So yeah, it's very exciting being here, and I appreciate it.
Awesome. So actually, on that note, what are you doing here? Tell me about your role. Tell me about the company you're with.
I'm with ClearSounds Communications, and actually I was here because we formed a whole nother business unit based on a challenge that we faced in the industry surrounding hearing loss. And so one of the things that's our biggest challenge in the hearing loss industry is inaction, and people's freaked out idea of the stigma of losing their hearing because they assume, okay, that means I'm old, or that means that, I'm broken. And so one of the things that we did is we looked at it and said, okay, how do we approach this? We've got to break down that psychology. We've got to get people thinking about the solution differently. It's a disease state, it's about wellness, it's about preventative health care. How do we do it? So what we did is we built a whole new business unit called Clear Digital Media, in which we get into the physician's office with digital content that really helps to break down that psychology for the patient while they're in a place that is an area of influence where they feel in a mindset of healthcare, and we talk about hearing loss more as a preventative healthcare issue as opposed to the idea you've got to put an expensive piece of technology in your ear that makes you feel old and look old.
And it's such an important, you're absolutely right, the messaging, the stigmas. What do you find to be most helpful in destigmatizing? Like what's been kind of some of your, you don't have to give me your secret sauce, but certainly what have you learned?
One of the things that we've learned is that we've got to get people moving beyond the technology and thinking more about their health care. So with hearing loss, there is proven evidence that there's comorbidities that really impact our long-term care. So for example, if I have cardiovascular disease, chances are I'm going to have hearing loss. If I have hearing loss and I don't address it, I will fall into a state of depression, and they've proven this time and time again because hearing is how we connect to each other. So if I can't hear you and I can't understand you and I don't do something about it, I step outside of my social circle. That leads to depression. Depression can lead to overeating. Overeating leads to obesity. Obesity can lead to diabetes. So there's such an alignment with some of the things that happen in healthcare by ignoring hearing loss, and that disconnect needed to be bridged so that it inspires people to take action.
So if you could leave everyone with one thing, how to take action today, what would that one thing be?
It would be to think about some of the signs of hearing loss in your family, address those, go see your doctor, talk to your physician about it, but also for people outside of the hearing loss industry, if you have a product or service you're challenged with breaking through a barrier for people to accept and take action on it, then think about digital content in the physician's waiting room, reach out to us and learn more about what we can do.
So how can people find you on the internets?
They can go to clearsounds.com. It's ClearSounds.com.
What about your Twitter?
ClearSounds.
Easy. Well, thank you so much for being with us today. Really appreciate you taking the time, and kudos for working on such an important issue.
Thank you so much. I appreciate it.